right, I am recording now, and we will go on to the PowerPoint, which I'm going to start at the beginning, which seems like a good place to start. So we're still talking about psychoactive drugs. So we've talked already about the different categories of psychoactive drugs and how the stimulants affect your heart rate or how fast your heart is beating, your respiration, how you're breathing, or your blood pressure, the amount of pressure that's on the veins and arteries of your body. We talked about some examples of some stimulants. Remember, stimulants are the opposite of depressants. And then that next one, it says, how do depressants affect heart rate, respiration, and blood pressure in those examples? We're going to talk about how a narcotic affects the body and how does a hallucinogen affect the body. We talked a little bit last week about nicotine, caffeine, amphetamines, and cocaine. Those are different types of stimulants. And if you remember, those stimulants are the ones that kind of increase your heart rate, increase your alertiveness. Think about that first sip feeling after you have your cup of coffee, or maybe a Diet Coke or things like that, whatever that caffeine fixes for you. And nicotine, found in tobacco products. It's also found in vape. It's an addictive chemical or drug, that stimulant is, because your body craves to feel that alert, or it likes the feeling of being like that. But you can also be addicted to depressants or sedatives such as alcohol or tranquilizers. Has anybody, I just started this weekend watching The Queen's Gambit. Has anybody watched The Queen's Gambit on Netflix? Probably because you guys are just so good at studying, you didn't have a chance yet. But over break, if you have a chance on Netflix, watch The Queen's Gambit and you will know a little bit more about tranquilizers. Today, though, we're going to dive a little bit deeper into the opioids and the hallucinogens. So we're going to talk about heroin and PCP, THC, marijuana, things like that. So narcotics, it was one of the questions on your lecture assignment. What specific drugs are considered narcotics? And these are only obtainable by prescription, and they are used to relieve pain. And some of you have maybe, if you've ever had maybe an intensive surgery or some sort of accident or things like that, or maybe know somebody who has, having morphine it's common in hospitals. It's easily abused, same with oxycodone, but it's not like something that's scary or anything like that. I feel like a lot of like narcotics and drugs, people kind of have these kind of stereotypes of like drugs are scary on all of this, and which is correct. But at the same time, I mean, hospitals need these for certain different things, but they also can lead to addictive behaviors, which is what we'll talk about here in a little bit, but these can be used to relieve pain. These narcotics, or the opioids, they depress the neural activity. So what this means is that your day-to-day life, when you are maybe not on any drugs or narcotics, you have a certain level of neural activity, and your neurons are allowing you to hear my voice. They're allowing you to maybe look at the screen or look at your notes. The senses and the things around you, your neurons are adapting and kind of coding through what that is. Your brain is interpreting it, and it's coming out as a message. Maybe that means your eyes are creating some sort of visualization from your brain and things like that. But if it depresses that neural activity, that means all of those things that I kind of just listed, all of those senses, all of the reaction times and things like that are going to be depressed or pushed down. It can temporarily lessen pain and anxiety. So you can understand why, if somebody maybe could be addicted to this, if you had to feel less pain and less anxiety because of a narcotic or an opioid, people can easily abuse that. It lowers your heart rate, respiration, and blood pressure. So you're lowering that heart rate, that beats per minute. Your breathing gets a little bit slower, and the pressure of your blood against your arteries and veins is less. It can cause drowsiness or relaxed state. It can be derived from opium, which is actually a poppy seed, or it can be made synthetically. So maybe you've heard of the opioid epidemic. This picture's like a little bit dated because we've got a different epidemic on our hands, but now, and a little bit, it says in 2014 in that one picture that almost 2 million Americans were abusing or dependent on the prescription opioids. And I think of all of like maybe the famous people that you've heard of that maybe have been addicted or passed away due to opioids or the opioid crisis. It says that 91 Americans die every day from an opioid overdose. That includes prescription opioids and heroin. So even if a doctor is prescribing somebody an opioid, still 91% of those, or 91 Americans are passing away due to opioids. So there is some sort of epidemic, but obviously right now it's probably getting a little bit shadowed due to COVID. So this is something that maybe a lot of different people have different viewpoints on, which is totally great. But just knowing that there is people who are dependent, abusing, or passing away due to opioids. Here's a graph that shows you the overdose deaths involving opioids in the United States. Okay, so the green one is considered any opioid, and on the y-axis, so as it goes up, this is death per 100,000 in the population. The purple, the blue, and the orange are different types of those opioids. So any opioid is in the green. You have those commonly prescribed opioids, such as natural or semi-synthetic. You've got heroin and other synthetic opioids. Now, if you look across the bottom, those are the years. So as you can see, especially since maybe like, I would say for sure we're getting in like 2003 to 2010 and so on, we are on a gradual increase. Looking at 2010 and that increase for the heroin, deaths per 100,000 here. It looks like the commonly prescribed are kind of going up and down. Other synthetics are going up. Any opioids are going up. And this is since 2015. And I'm sure that now it's also increasing. Here's another visualization to show you the age-adjusted rate. So this is the number and the age-adjusted rates of the drug overdose deaths by state. Okay, so we've got some of the darker numbers, or the darker states here are going to have a higher rate of deaths due to the opioid crisis. Here on the bottom, it gives a couple of different examples. So it says West Virginia is 41.5 deaths per 100,000. But Iowa, for example, is 10.3 deaths. So we're kind of in this like lighter pink peachy color. And maybe if you're from a different state, you can kind of take a look at this visualization just to show that other states have a much more dramatic issue with some of these narcotics and opioids. Morphine, you maybe heard of morphine, like I said, through maybe an intensive surgery or maybe a movie or a TV show. This is a strong sedative and pain relieving drug that is derived from that opium, which we talked about before. It can be used medically, but it also can be abused. And it works by preventing the pain neurons from firing or releasing pain signaling neurotransmitters into a synapse. Okay, so all of this stuff seems like a big sciencey term, but let's talk it out. So we've got, it's preventing the pain neurons from firing. So your neurons, remember, kind of act like when you play telephone. Maybe you played telephone in elementary school, or maybe you do now. I guess that's kind of fun. When you pass a message on, your neurons act very quickly, but if it can prevent the pain neurons from even firing and sending that message in the first place, you're not going to feel that pain sensation. It's kind of similar to like if you've ever had to get like some sort of like numbing cream, or get a, I can't, the term is kind of losing my mind right now, but it's like if you've ever had to have like some sort of point numbness or things like that. It does the same very similar thing where it just prevents those pain neurons from firing. Essentially, it'll give you that numb feeling. It just like doesn't feel like anything. Releasing pain signaling neurotransmitters into the synapse. So it can also stop releasing that pain signaling neurotransmitters. So those neurotransmitters are also how we communicate. We've talked about different neurotransmitters. You've maybe seen them in your lab when we did the This Is Your Brain on Drugs lab. There was some neurotransmitters on the front page of that lab instruction. And those neurotransmitters are communicating as well through our neurons. So morphine can either stop the message from the beginning or prevent those kind of messages from getting into the synapse, which is essentially where it's received. The effect appears 20 minutes when given intravenously, so like an IV, if you've ever had an IV, and then 60 minutes when given by mouth. So here would be like an IV or a shot, and this up here would be like a pill or given orally by mouth. The effects can last 3 to 7 hours, which would make sense for someone who's dealing with pain or some type of surgery or things like that. Heroin, on the other hand, it leads to no pain, but also this feeling of euphoria. Euphoria is that kind of like nothing is wrong in your life, that like good feeling, it's pleasurable. We'll talk about that a little bit more as we move forward, but it's also delivered to the brain, but it's converted into morphine. So if somebody is using heroin, your body will convert it into morphine thinking that it is that pain reliever. Heroin can be injected, inhaled, or smoked. It is derived from morphine. The purest form is a white powder. Black tar heroin is a sticky, dark brown, foul-smelling form of heroin. I'm not as familiar with black tar heroin because you think of all the movies and things like that you've seen about heroin, and that doesn't really make me think of it, but it's out there. Heroin withdrawal is distinct, including an intense desire for the drug, which is similar to lots of other drugs, but also sleep disturbances, meaning maybe some insomnia or they can't sleep, dilated pupils, and muscle tremors. So muscle tremor would mean that it's kind of shaking or that it doesn't relax. In having an extreme dependency or being dependent on heroin is common when people abuse it, as well as it can lead to HIV, hepatitis, and other infections due to shared needles. Okay, this is kind of where it's a little confusing at first to understand, but if someone is injecting heroin, most likely they are not using the same cleanliness techniques as somebody would if you were to go get your flu shot or go get other things at the doctor that are sterile and safe. But somebody injecting heroin may give themselves or transmit HIV, hepatitis, which is also a disease, and other infections due to that shared needle. There's a video here, but I'll let you guys watch that on your own. There's a different video that I'd like to watch in a couple of slides here. The oxycodone is used to treat moderate to severe pain, okay? So this is, I can already tell that, even if we didn't know much about oxycodone at this point, that when it says it can be used for moderate pain, that it could lead to maybe an overdose or things like that. It can be used medically or abused. It has that feeling of euphoria, which is like that relaxation and reduced anxiety feeling, which if people are actually dealing with mental illness and they are abusing oxycodone, they're just trying to suppress what those feelings are, because that oxycodone is giving the individual that feeling of euphoria. The effects are attained between 30 and 60 minutes after the administration, and then they are available, or the duration of how long that euphoria can be felt is 3 to 6 hours. If somebody is dealing with withdrawal, that's kind of hard to say twice, oxycodone, they may feel anxiety or panic attacks, nausea, insomnia, muscle pains and weaknesses, maybe a fever or flu-like symptoms. And as you can see, most of the time when we're talking about a drug and a person having a withdrawal symptom or some sort of reaction, most of the time it ends up feeling of like this need for the drug to suppress all of these other things that they're feeling: anxiety, the panic attack, the nausea, the muscle weakness, etc. Here are some side effects of oxycodone. It's a little blurry, so I apologize. I hope it's not too blurry on your screen. Some of the big things are kind of highlighted in red. The hallucination, the confusion, and the fainting and the dizziness are a big kind of side effect of the central nervous system. The mouth, tongue, and lips begin to swell or dry. The face may be seen to be swelling as well as the eyes. You can see that also maybe the throat will start to become swollen, as well as like a hoarseness or a difficult swallowing. So when somebody says that they have a hoarseness in their mouth or a hoarseness in their voice or in their throat, it's kind of that scratchy like sound or sensation. The skin may have some hives or rash. It may be really flush, or someone might start itching and sweating. Somebody who's dealing with oxycodone or withdrawal, or even dealing with an abusive relationship with oxycodone, may find it difficult to breathe or swallow. Their heart rate can be too fast or too slow, so it could be irregular, and there may be some seizures. So there's a lot of side effects that can affect somebody who's dealing with oxycodone. So we're gonna watch this video. I hope that it works. I have it pulled up on my screen. There we go. And then we will get back to what we were doing. This is a commercial from Super Bowl 50, or during Super Bowl 50, that is just like a kind of a PSA or a public service announcement that's talking about like the effects of heroin. So it's just 1 minute of your time, and we'll watch this video together. You guys can control your own volume.
She had a couple pills on a little dare. Now she's missing class. She's dropping her pom-poms. Nobody knows where she is, not even her mom. Everybody thought she was the all-American girl. So there goes the books, it's all about the score. There goes the doggy, life is such a bore. There goes the family, she's got a new friend. There goes the looks, this is the end. I guess she really was the all-American girl.
Pick up heroin and you'll throw away everything you love. Share your stories on Instagram with #heroin.
All right, so that was just a quick little commercial PSA that happened during the Super Bowl. And some of the things that we can see in that video are kind of that anxious energy kind of bouncing when she was sitting in the chair, some of that kind of flushed, sweaty face look, not only because maybe the person was stressed, but also because of the way that the body reacts to that drug or heroin. The next thing we're going to be doing and talking about is how it affects neonatal, or essentially kind of baby in utero, and how, let's see here if I can, there we go. So neonatal abstinence syndrome is a term for a group of problems a baby experiences when withdrawing from exposure to substances in utero. Okay, so this is meaning that the mother of the child is using or abusing substances while that the baby is in utero. And this NAS, is the problems or the experiences that that baby is feeling when they are kind of having withdrawal symptoms. So we talked about what it's like to withdraw as an adult in the other slides, maybe some anxiety, sweating, dependency, panic attacks, muscle spasms, or seizures. Well, imagine that happening in a baby who maybe doesn't understand, can't comprehend, or have any sort of like cognitive realization that this is happening. So that's a little bit more about that. It's as if you can understand that every drug passes from the mother's bloodstream through the placenta into the fetus. This is then after the baby is born, it suffers withdrawal, which is those withdrawal symptoms that we have seen. Essentially, the baby is dependent and addicted to the drug that the mother is using, because it goes through the placenta, and pretty much, you know, everything that the mother eats or drinks is affecting the fetus in a positive or negative way. At birth, the baby's central nervous system becomes overstimulated, causing withdrawal symptoms. So a baby that is dependent on drugs after birth is probably crying a lot, irritable, muscle spasms, things like that, because essentially the baby is dealing with an intense amount of withdrawal. There's another video here, but we're going to skip over that one if you'd like to watch it on your own. The prenatal drug exposure. So this is the withdrawal symptoms in neonatals can be associated with certain drugs. And here's a couple that are the most common, such as opioids, benzodiazepines, barbiturates, antidepressants, alcohol, and tobacco. And that pie chart there just shows the percentage that most of the time it's not just one substance. It says that 66% are the polysubstance exposure, meaning that a prenatal is exposed, or a fetus is exposed to more than one of these substances. Most likely if the mother is making bad choices about, you know, using substances while pregnant, that it's most likely more than one, as opposed to single substance exposure, which is 34%. So why is this a concern? Why is this neonatal syndrome a concern? Well, every 25 minutes, a baby is born suffering from an opioid withdrawal. The average length or cost of that hospital stay, so the newborns, how many days they're in the hospital because they have to be closely watched, can also increase because of you know, the having to be watched. If you're in the hospital, it's just as like staying in a hotel, except for it's a little bit more expensive and not as fun sometimes. So as you can see, the average cost and length of stay in the hospital increases with a baby that has NAS. NAS and the maternal opioid use are definitely on the rise, which is why this is important to talk about. Across the bottom, I know it's a little blurry here, but you can see that we have 2000, 2003, 2006, all the way up to 2012, and you can see this gradual increase in the rates of the opioid use and how they are on the rise. I apologize that visualization was a little blurry. So we also, we just talked a little bit about like opioids, heroin, morphine. Now we're going to talk about the hallucinogens. So these are the ones that alter your mood, your thought, your sense perceptions. Also, this includes your vision, hearing, smell, and touch. So this is your LSD, your ecstasy, your marijuana, things that are kind of affecting your mood and your thoughts, like it says, your sensations that you're feeling. The hallucinogens, they affect your neurotransmitter glutamate, which causes the release of more dopamine in the brain. And dopamine, remember, is that pleasurable neurotransmitter. It's essentially when you are feeling happy or something that is good. While that can be subjective, your body does have a chemical reaction there where it releases more dopamine during that, whatever that is. And so if a hallucinogen is affecting that glutamate and causing more release of dopamine, your body thinks that this is, you know, more pleasurable, more happy, things like that. It creates an auditory or visual changes in the moods, thoughts, and feelings. So you may have a mix of sensory messages. Oops, I dropped something. Just a moment. The mixing of sensory messages, you may hear colors or smell tastes. While it's kind of funny to joke around about that, hallucinogens actually can affect this as well. It can affect of trips. Maybe you've heard of somebody saying, oh, it was tripping out, or a movie or something like that, that are different for each person. It can result in hypothermia. Hypothermia, even though it feels like we're going to have hypothermia when we walk outside in the middle of February, it is where your body is at a high temp, or it can have convulsions or death. Hypothermia also can be when your body's at an extremely low temperature. So LSD, listen, and I'm going to butcher this name, so we're going to try real hard here. Lyserginic acid diethylamide is called LSD. It is found in a fungus that grows on rye and other grains. It's a powerful hallucinogenic drug. Minute quantities produce strong effects. So even minute, small quantities can produce extremely strong effects. And it's similar to the neurotransmitter serotonin. It's produced in crystal form. So when I think of crystals, I think of things like sugar, like when you're baking and you see what a crystallized sugar-like form. These crystals are then converted to a liquid for distribution that are odorless, colorless, and slightly bitter in taste. They're commonly sold as a blotter on paper, so you can see a picture there of what that blotter kind of looks like. The effects vary by person, and a trip can typically last up to 12 hours. It can have, during this trip, or essentially the sensation, there can be flashbacks, psychotic reactions can occur. When I think of this, I think of like 21 Jump Street, the movie. People are placed on controlled substances list in the 1970s, and this does not meet the definition of addictive. So you really can't be addicted to LSD, but your body can have some negative side effects or make not conscious decisions while maybe on one of the trips, essentially. Ecstasy is also a hallucinogenic drug. It provides lower inhibitions and pleasant feelings and greater acceptance of others. Although we maybe in the world need a greater acceptance of others, we should not all go get on ecstasy. Also called MDMA, this blocks the serotonin reuptake, prolonging its good feeling. So it blocks, like I said, that reuptake. So essentially these neurotransmitters of serotonin are released, and then you can kind of think of them like, let's just say they're like little floating M&Ms. Hopefully I'm not making anybody craving any candy here, but we're thinking of some floating M&Ms. Essentially, your body releases serotonin when something is going on, that good feeling, and there needs to be a synapsis or an uptake for us to realize that there are maybe less serotonin. So here's that synapsis, essentially. But what's happening here is it's blocking that serotonin reuptake. So it prolongs this good feeling in here, and we're not kind of being done eating the M&Ms, I guess you could say, if you're following along with my analogy. The effects begin after 30 to 45 minutes and can last 3 to 6 hours. Even moderate users may experience permanent brain damage to serotonin nerve endings, and even memory and verbal reasoning problems can last up to a year. Because your body is experiencing an immense amount of serotonin that's not being uptake or kind of essentially used up or recycled in the correct way, we can damage these serotonin nerve endings that are maybe on this side over here, and that may affect, when somebody's not on ecstasy, how the serotonin is released in the first place. And then you can also have some issues with memory, short-term and long-term, and verbal reasoning problems that can last up to over a year. Another thing that can happen on ecstasy is dehydration, a rapid heartbeat, tremors, muscle tension, teeth clenching, and a high body temperature. So essentially, these are all hand in hand, right? If you're dehydrated and you don't have enough fluid in your body, your heart is going to have to work a little bit harder to make sure that we get the correct amount of liquids and oxygen to the rest of your body. So here we have that rapid uptake in the heartbeat. Because your heart is racing a little bit more, your muscles might become a little bit more tense. Maybe if you've ever been really nervous about something, you'll start to notice that your teeth are clenched. That's the same thing here. And because your heart is racing and your muscles are tense and your teeth are clenched and you're dehydrated, it makes sense that there would be a raise in body temperature. Think of your reaction when you go outside and you're really cold, right? You're walking through the really cold. Maybe you start to tense up and your body starts to shake. You clench your teeth, things like that. Very similar experience here. Combined with alcohol, ecstasy can be fatal, meaning that it can cause death. Here we have marijuana. Now we know from the news and things like that marijuana is legal in some states. Marijuana is derived either from the cannabis sativa or cannabis indica and hybrid hemp plant. Okay, these are flowers that are made into concentrates, edibles, and topicals that can contain over 100 active compounds. So essentially, it's kind of derived from these situations here, and it can make into cannabis that has over 100 active compounds. Compounds are, I think, of like a group of molecules. Two of the most abundant types that are most studied are called THC or tetrahydrocannabinol or the CBD, which is in the news a lot lately. I feel like there's kind of it's a little popular, so we'll talk about those here quickly. So what marijuana does is it raises the level of dopamine. Dopamine and serotonin are both of those pleasurable feeling, euphoria feeling, happy-go-lucky neurotransmitters, that feeling of intense well-being or elation, so just being extremely happy. It lowers inhibitions and produces feelings of relaxation. It can be stored in the body for up to 30 days. So that's also when you think of maybe a movie or maybe things like that where you've seen something where they have to get drug tested, and maybe in the movie somebody's super nervous. I'm thinking of like All American, I think, if you guys have seen All American on Netflix, where the main character, his football team has to get tested for marijuana, but it was like more than a week ago that he had used it. It can be stored in the body for up to 30 days, which is why that drug test could be failed in that instance. Users experience alterations to vision and judgment, as well as impaired motor coordination with slurred speech. So it's similar to alcohol in a sense that you have slurred speech and impaired motor coordination, but a little bit more altercations to your vision and judgment than alcohol. It is frequent and or long-term uses. It may increase risk for testicular cancer and serious mental health problems. It can suppress your immune system, which is not great in the times that we're in right now, where we need to be, intaking a lot of vitamin C and making sure that we're not getting sick, because our immune system helps fight off those foreign invaders and pathogens, and it can also impair memory. Parts of the cannabis plant. So you have a node, a stem, and some fan leaves, and there's male flowers and female flowers. And this is just to show that there's different parts of that cannabis plant. I don't know, I've never actually seen a cannabis plant like this in person, but what we can tell is that there's different parts to it here, and then there's different male and female flowers. And they use the different parts of that plant to make the cannabis. And here's a visualization of that as well, using that plant. Once they do that, it can be kind of used for different things, such as a hash, a bubble hash, a hash oil, a wax, a shatter, or liquid THC. It can be concentrated forms of medical marijuana, include the butter up here, the wax, the live sugar, and the shatter. So this is ways that medical marijuana can be used. Here's a couple of funny, not really funny pictures, but just some ways that people may intake marijuana or cannabis. So the difference between THC and CBD. So you've maybe seen CBD maybe in the news or in some popular products online these days. I heard that one of our neighbor dogs where I live, they actually use some sort of like CBD to help calm the dog. This is news to me. I have no idea how that works essentially in dogs, but what we do know is that CBD and THC, while they may have similar effects, they affect the brain in different ways. So the THC or the tetrahydrocannabinol versus the cannabidiol, psychoactive in the THC. So psychoactive meaning it's affecting the brain most of the time in a negative connotation. So THC has a wide number of pharmacological actions, some of which have been known since it has been made. So it can be used as a sedative, it can be used as a stimulant or an anti-inflammatory or immune suppressant. So THC can be used for a lot of different things, but also CBD is pretty well documented, and it can help for seizures. It can help anti-seizure effects. It's suggested to be used for anti-inflammatory, anti-cancer, all of these things. There's helping with chronic pain and things like that. So THC and CBD are very different. There's a lot, probably more detail that we won't be getting into for this class, but know the difference, especially moving forward in your life. If somebody offers you a product with CBD in it, it's probably, maybe it's not that bad for you. It can help with anti-seizures or anti-inflammatory relaxation feelings. THC, on the other hand, it's a lot different. So here's a little bit more about the historical context of cannabis. We're not going to get really into it that much, but just know that, it's been around since the 1600s where it was brought to Jamestown, but it was also used for medical uses dating back BC 1400 or 2000. There was a Marijuana Tax Act in 1937. What else we can know from that is that in the 1960s, THC and CBD identified and synthesized at the University of Mississippi and becomes the official grower under the federal regulation. In 1996, however, California becomes the first state to legalize medical THC. And we all know that that's a little bit different now, but that's just a little bit of background. You can also see that this visualization may be as well out today, even since the most recent election. But so ignore the dated visualization, but just know that in some states, the legality of cannabis is in that darker green. It can also be used for medical use in kind of that more electric green. It's legal for medical use, but limited THC content in that sage green color, and it's prohibited for any use in that gray color as well. So the federal government does not recognize the medicinal use of marijuana, so it is a state-by-state determined regulation. So synthetic marijuana, there's currently 2 forms of synthetic THC that are FDA approved. So most of the food that you guys eat is FDA approved and things like that. So when something is FDA approved, that just means that it's pretty much legit. The first one is a cancer-related nausea and vomiting and anorexia weight loss in AIDS patients. And the other one is a cancer-related nausea and vomiting. So this is how that synthetic marijuana can be used medicinally and that are approved by the US and the FDA. Those are some people that I don't know. Just kidding. All right, some psychoactive drugs that we talked about. So far we talked about nicotine, caffeine, amphetamines, and cocaine that were considered stimulants. The sedatives and depressants were like your alcohol and your tranquilizers. What we talked about today were those last 2 bullet points. So the opioids, meaning the opiates, heroin, and the PCP. And lastly, those hallucinogens, which are the LSD, the THC, and the marijuana. We talked about, like I said, those 4 psychoactive types of drugs. We know that stimulants raise your heart rate, your breathing and your blood pressure. Some examples of stimulants. We're on that last slide here. So your nicotine, caffeine, amphetamines, and cocaine. Depressants lower your heart rate, lower your breathing and your blood pressure. Some examples would be tranquilizers or alcohol. How does a narcotic affect the body? And how does a hallucinogen affect the body? So those narcotics like morphine and heroin, they can relieve pain and anxiety, but can be easily abused. Thinking of heroin and morphine specifically, and then opioids. And then the hallucinogens can affect the body by also kind of relieving that pain and anxiety, but it can alter your slurred speech, your vision, your sensations are affected, and things like that. All right, are there any questions about the material today?